welcome everybody. We're honored to have you here. We're so happy you've joined us in honor of Canadian Infertility Awareness Week. We are, of course, dedicated year-round to supporting the fertility community, whole family health. People of so many stories and backgrounds with a diverse range of gender and gender expression and ethnicity, single people and couples, people trying to conceive naturally, and others who've been, trying with a full range of assisted reproductive technology supports. Some of you for many years. And so we see you, and it's our aspiration to take this opportunity to just help raise awareness and to normalize and change this conversation around infertility. And so, as you know, we have some very special speakers today here, beginning with three very beautiful people who will be courageously sharing their stories, as well as Dr. Caitlin Dunne from PCRM, Pacific Center of Reproductive Medicine, and Kristina Pistotnik and myself as co-owners of Whole Family Health. There will be an opportunity to ask questions throughout the event, so please feel free to type them into the chat. Also feel free to private message our IT co-hosts, so Catherine and Kelsey, if you have any questions or need help with the technical end of things. So they have shared their phone numbers too. If you end up losing connection and you can't communicate with us through Zoom, you can feel free to give them a call and they will try to assist you. And so without further ado, we are going to begin with our first three speakers. We have Marina and Briana and Kristina. And so it is our hope to offer some hope and inspiration through the telling of their stories. And there's always something so powerful, I think, when we hear another person's human experience that resonates and that we can relate to. And so it can be very validating, I think, and relieve some of the feelings of isolation. And also as somebody who has experience in fertility myself, I just, what I also know is that sometimes it can be hard to hear another person's story, particularly if they've had success. And so, I know that for me, I couldn't always predict how I was going to feel. And sometimes I was fine. And then suddenly I was completely derailed. So I just want to acknowledge how complex and not linear at all this journey is, and just give you all the space to just take a moment to check in right now and just sense into, whether it would feel helpful for you right now to hear these stories. We are recording the event, so if it's not available to you in this moment to take in these stories, then please feel free to turn your device speakers off and you can stay nearby so that you can rejoin in about 15 minutes or so when Dr. Dunne comes to offer what she has to share. So just take a few moments here before I introduce our first friend and just take good care of your hearts. Take good care of your hearts. Okay. So our first speaker, our first beautiful sharer is Marina. And so, Marina, I'm going to pass it over to you.
Thank you very much, Alda. First, I'd like to thank you for inviting me to participate. It's really an honor. It's an honor. And thanks to everybody that joined. I do have my cheat sheet because I don't want to sidetrack. So if I'm looking down, that's just me going to important things that I want to mention. We got a couple of questions from Alda to answer in order to share our experience. So I'll just start. We started trying to conceive approximately 4.5 years ago. Honestly, I don't even remember. It's been so long. We haven't done any testing prior to actively starting. We thought everything is fine. We'll get pregnant in no time. We were optimistic. Of course, that's how you go into it, right? But after 6 months, I thought that there must be something going on. Not everything's not fine as we expected. We didn't expect to have this, I don't want to call it a battle, I'll call it a journey. And it was really devastating getting my period month after month. So the emotions were all over the place, of course, as I believe a lot of you can relate. I had tremendous support from my husband, my parents and his parents, which I'm really thankful for. Of all the people involved, it of course hit me the hardest. My husband was sad as well, but it's different for women to deal with infertility because we're the ones who are biologically destined to grow a child. And in a lot of cultures, including mine, your self-worth as a woman is connected to that, being able to get pregnant and have a child, right? Anyways, we went to all the different tests to make sure at least our bodies are fine, and they were, which is both a big frustration and a big blessing to be categorized as unexplained infertility. And in a situation like that, it makes you resort to an explanation like it's just not the divine timing. That's why it's not happening, because you can't rationalize. Everything's fine, but nothing's going on, right? Nothing's happening. That was a lot of confusion and a constant wondering, oh, maybe this cycle, oh, it will happen one day, right? But still nothing. Whenever someone told me, oh, just relax, it will happen, I got very mad and frustrated, which also I believe you can relate. And then I think the turning point for me was starting to go to acupuncture treatments, and finally starting with a mindfulness class. Acupuncture assured me that I'm helping my body on the body level, and the mindfulness class helped me to deal with all the feelings that I just described. It relaxed me, and I was finally able to accept that, okay, fine, it's not happening. We're not going to get pregnant naturally as I always wanted. We have to go through IVF, which I was afraid of. I was really afraid of all the procedures. And I remember, I don't know if it was Alda that mentioned, but when we began our mindfulness class, they said, someone in this class will get pregnant either during the class or after the class. And I was like, yeah, right. Yeah. But anyways, it did happen. And right before our first IVF cycle, which was amazing. So the effect of pandemic in our journey, honestly, it didn't affect us as much as I expected it will. It did when I contacted a clinic in BC, wanting to go there initially. And they told us that we need to quarantine for 2 weeks prior to any appointments, and quarantine in BC, of course. I was able to do it due to the nature of my job, but my husband just couldn't. So that wasn't an option. So we just went to a local clinic, and we were able to do all the testings all the exams that we had to. So from that point of view, everything was okay. Regarding the resources I found to be most supportive in all this, definitely my husband's support and his constant reassurance. That man has patience of a saint. I would also say that mindfulness class was a pivotal point, definitely. I'm a big believer in body, mind, soul connection. And I think that you can't cure one without including the other two in the equation. So I had to work on all of them. So I included my body level, like exercise, supplements, acupuncture. Then, of course, finding a support group in that mindfulness class. That was just priceless. I was able to see I wasn't alone, and fertility struggles can make you feel very isolated, as Alda mentioned at the beginning, especially when you're bombarded with all the pregnancy announcements on social media, which is never pleasant. So meeting others and sharing all those feelings was really a great help to clear my mind and to remain calm and optimistic, hopeful. Okay, so I probably have to end, right, Alda? I hope I'm not over. Yeah, so my final words will be, I won't tell you to just relax, because in this situation, you can't. I mean, it's, yeah. I think different things will work for different people. I needed to know I'm doing everything that I can to help myself and my husband. Some might prefer to truly let go. It all depends. So whatever you resonate with, try it. Consider doing your research. See what techniques are there to cope with everything that we have to deal with. And dive in. I believe, that was always my belief, that it will be okay in the end. And if it's not okay, it's not the end. So, thank you.
Thank you so much, Marina. Thank you so much for sharing. So yeah, so there's so many different ways this can unfold, right? There's so many different journeys. There's all, you know, how long it takes, how it happens, all of it, right? And so for those of you who logged on more recently, we are starting with our 3 beautiful patients who are sharing their stories, and just inviting you to take a moment to check in, to feel into whether it's helpful for you to hear these stories right now. We know that it's not linear. Sometimes it's helpful, and sometimes you're not in the right space to hear these stories. So please take a moment and take care of your hearts. It's recorded. If you want to listen to these stories at another time, we'll make them available to you. And so thank you so much, Marina. Our next beautiful share is Briana.
Hi. So my name is Briana, and our journey has been very long, over 10 years. We started trying to conceive in 2009. And after we got married, and we tried and tried and tried, and we knew that there was an issue because I didn't have regular cycles. Like I would go months and months and months without a menstrual cycle. And so we went to the doctor, and they diagnosed me with PCOS. I also have hypothyroidism and just lots of health conditions for me. So we got referred to the Royal Alec Clinic, and we went there, and we did the semen analysis test, and we ended up doing 3 semen analysis tests to confirm that my husband was sterile, which was really, really, really hard on him and me, but mostly him, because it's heartbreaking to realize that you aren't going to be able to bear a biological child. And so we had to take a step back and discuss, like, if we wanted to move forward, if he felt comfortable using a donor, and what would go on, like if we'd be able to continue. And he wanted to. So, he said to me that blood doesn't make a family. So we went forth and found ourselves a donor, and we tried 3 IUIs, which failed. So we moved on to IVF, and we did 7 frozen embryo transfers in total so far, and have 2 beautiful daughters. And unfortunately, we did have 3 miscarriages. It was really hard. And when you put that much effort and time and money and hope into something, and nothing comes of it, it's really heartbreaking. But we did get our 2 girls, and we are going to try again. We have an appointment in May to go back to PCRM to try again, and hopefully can get there. My pregnancy with my last daughter was difficult. I ended up having a subchorionic bleeding, and luckily Kristina from Whole Family Health was there to keep me grounded, and she used this weird smoke situation around my toes, and I was like, this is crazy, but it worked. It was gone. Like by the next ultrasound, the bleeding was gone, and it was a miracle, really. I was so thankful because we were sure we were going to lose this baby, and luckily we didn't. So I'm very thankful to them, and are definitely going to be hitting them up again soon because we're starting over again. So it's a sad and lonely journey, and the only advice I could give is to find a support group. There's lots of them on Facebook. Like the Edmonton Infertility Support Group on Facebook is incredible. There's so much, advice and so much positivity, and it's a great place to be a part of. There's also a moms group. Like if you're already a mom and you're still trying, there's a infertility women's moms group. It's really great. But find support where you can, and don't be ashamed to talk about it, and be honest and open, and educate yourself and advocate for yourself, because sometimes they don't necessarily know everything, and just educate yourself, because it's better to know what you're going through, and if you have questions, ask for them, and don't stop asking them until you understand the answer. That's all I could say. And that's all I got to say. It's my journey. It's still going.
Thank you so much, Briana.
Thank you.
Thank you. So Briana's own particular journey. Thank you so much for sharing that. And we have our third beautiful woman who is here to share her story. So again, if you have any questions for any of our women here, for Dr. Dunne, Kristina, or myself, or the other acupuncturists, you just let us know. Feel free to put them in the chat. Again, we are just sharing stories here. And so if you've just logged on, just check in, see where you're at, if it's something that would be helpful for you right now. Otherwise, this will be recorded, and there will be another opportunity to listen to them. Okay, thank you so much, Briana. Kristina Amelia, I'm going to pass it on to you. Thank you so much.
Thanks, Zelda. So as I was listening to Marina and Briana, there's elements of each of their stories that I really can connect with, but I think it kind of shows you that you are not alone, but at the same time, everyone's journey is different. So for us, we tried to do everything the way everyone told us. You get your career in order, you get your house, you get married, then you start to have babies, right? So that's kind of what we've all been traditionally told is kind of how you do it. So we got married in 2018, and so we started right away trying to conceive. I think I'd gone off birth control, I think it was about 6 months prior, just to get it out of the system. And similar to Briana, my cycles were ranging anywhere from 30 days to 60 days, and it was not consistent. So trying to conceive with a lot of ovulation sticks and timed intercourse with my husband, which definitely takes the romance out of it. Nothing knocks romance out of it. Like, okay, you need to come home and we need to try right now. And for months of, again, getting periods and just sort of seeing that disappointment every 1 to 2 months. So for about 6 months, we tried the natural way. And then I realized something wasn't wrong. So I went to see my GP. That was probably January of 2019. And so she started to run all the tests just to sort of see if there's anything that we could do with her expertise to help us proceed. So we went for ultrasounds, I did blood tests, I did a bunch of things. And then I was also diagnosed with PCOS. In addition to that, I also have Hashimoto's, which is a thyroid condition, and then at the time chronic hives as well. So I was kind of my body was just not happy, not happy with me. So because of all these things, she recommended us to pursue fertility treatments. And so we put the recommendation into PCRM. And then at the same time, I had other people recommend acupuncture. So this is at about, I want to say mid 2019. So I started with Elda in June of 2019, and we ended up starting with PCRM in August. So I wanted to do a more holistic approach in terms of Western medicine and PCRM, and then also making sure that I was taking care of, like Marina says, my mind and body as well. So we did a consult. Myself and my husband met with Elda, and she did a full-on history, tried to sort of get a sense of where I was at. And then I started with Elda for about once every 2 weeks. I was doing acupuncture treatments. And then in addition to that, I also did, I think it was the yoga puncture seminars with Elda and Michaela, where it was a group of people going through fertility issues, and we would gather once a week, do some yoga postures, some mindfulness, and some acupuncture as a group. And that I found is where you start to really see the diversity of women going through this journey. It's not just women that are married or older, it's everyone. That's a broad spectrum. So that started to sort of make me think, okay, I really am not alone. And so we started with PCRM in August. And again, we went through all those batteries of tests. And then my husband also has some male factor issues. He's low motility. So that meant that IVF was going to be our most beneficial route. But we wanted to try an IUI because we thought, you know what, we'll just try once and maybe we'll hope for the best, because it is a bit more cheaper for us. And so we thought if we can get success with an IUI, then we'll try that first. So we did an IUI in February of 2020, and that was not successful. And so after the one, we decided, okay, I'm 39 right now. So at the time I was 37, 38, and I was worried that my time was running out. So we switched directly to an IVF, and we were ready to go. And I was waiting for my cycle to start so I could start the injections, and then the pandemic hit. So we were ready to go. We were mentally prepared. We had the money saved up. We were like just so excited at this point to be moving to the next step, and then the pandemic hit. So that was a big sort of kick in the gut, because you didn't know when you were going to be able to restart your fertility treatments. And even the acupuncture clinics were closed as well. So it was about a month and a half, 2 months where everything was up in the air. So thankfully, PCRM was able to open up. It was in May, and that aligned with my cycle, and I was able to start treatments in June. And we did an egg retrieval in mid-June. We ended up with 3 viable embryos. And then because I had the ovulation syndrome, where you produce a lot of eggs, and is at higher risk to do a fresh embryo transfer. We waited to do a frozen embryo transfer, and so that happened in September of 2020. And thankfully, we were successful in our first try, which is not common. So we are now expecting, and I'm 36 weeks pregnant right now, so we're expecting in the next about 3 to 4 weeks. So all the emotions that Marina and Briana had described, I definitely agree with and feel as well. There's such a sense of grief when you're getting your period every month, and people are posting happy maternity announcements, pregnancy announcements. And then, so you feel so much happiness for them, but at the same time you're grieving. And it, like Alda said at the beginning, it hits you at the most unassuming times. So it felt like sometimes that the infertility would steal all this joy that I wanted to have for everyone else. It feels like you're not in control. And I know most of us like to be in control of the situation. So not being able to plan and have a pregnancy happen when you want it to. And like Marina said, it's something that you're, as a woman, born to do, and you try to do it and you can't succeed. You feel like you're a little bit of a failure. Again, being anxious and impatient, because I was 37 when we started, I was worried that everyone says, oh, you're really old, you better hurry up and have kids, because you know those eggs won't last forever, right? So you kind of like are already put on a time clock at the beginning. And but thankfully PCRM and ELDA did reassure you that you do have more time than a lot of people tell you. It's not as easy, but you do have a bit more time. And I think the last one is kind of regret, because why didn't I try and start earlier? What if I did this? What if I didn't do birth control all those years? All those things kind of play into your mind. And so you spend most of your time kind of replaying, what if I did this and what if I did that, which isn't useful because you can't go back and change what you've done. So I would say the resources that I found most supportive, again, was acupuncture. So I really developed quite a great relationship with ELDA. You spend an hour, you talk through everything, whether it's like body stuff, mind stuff, all that sort of stuff. That really does help sort of relieve stress and just have that support system that's a one-on-one, that's a bit more intimate than, say, your friend. The mindfulness practice and the community that I found there's a couple of ladies that I still keep in contact with. And I found that the more I was opening up even to my circle of friends, my coworkers, the more I knew that other people were going through similar struggles. And then another one thing that I like to do is make sure I'm researching everything so that I know that, like, even if it was injections, I would watch YouTube videos, make sure that I understand what was going to feel like. And so then in my mind that I could prepare myself for all the things that was coming down the road. So parting words of advice, I would say the main thing is don't carry this burden on your own. The more I opened up my struggles to conceive, the more I realized there's so many other people navigating the journey, and you really need to find an approach that works for you. There's not like a one size fits all. Some people, for me, that was combining fertility treatments with mindfulness and acupuncture. For others, it could be as simple as finding a way to remove stress, adding some different medications or supplements to help with ovulation. And no one approach is guaranteed, but so I would just say find something that works for you and work with a support system that you find would be beneficial. So that's everything for me, ELDA.
Thank you so much, Kristina. Thank you. So our gratitude toward Kristina and Marina and Briana for sharing their stories. I know it takes some guts to share. It can be quite vulnerable to share. If any of you have questions for any of them or any of us, please feel free to type them into the chat. We'll do our best to get to them, and we'll collect them, and we'll be able to answer your questions at the end of the event.